Well, I think some of the people involved in this meeting are the people actually developing the data, but I'll give you my opinion of it. One is um, without having a better therapy, the value of biomarkers is questionable. Second part, that's just an overall view. Second part, if we did autopsies on people, which is the definitive standard of Alzheimer's disease, the diagnosis wouldn't be reliable. The gold standard is not reliable. Why do I say that? If you do it based on plaque and tangle density, and you look at older people over the age of 80, 85 years of age, everybody has them. There's no correlation of any of the pathology to the disease. And from older studies like Bob Terry's, things like neuronal loss don't correlate with the disease because neurons are lost during aging and through many of the episodes of life. So I think that this latter point is probably much more important than the former point, because the former point, you can always say the biomarkers are going to be useful when we have a good therapy. Okay, great. I've been waiting for that for close to 40 years. And I've been involved in biomarker development also. And that was always what I was told when I said they were of limited value. Second part is really troublesome because it means that they never can be 100% reliable because there is no 100% reliable standard to compare it to. And further, third thing, if you tell people that they're going to develop the disease in 20 years, what value is that? It's going to cause them more despair, probably more likely to develop Alzheimer's disease earlier. And we already have an incredible prediction of people to develop Alzheimer's disease, APOE genotype. It's not definitive, but your risk if you're homozygous is 10 times higher if you're E4, 4. And if you're 3, 4, you're about 3 times higher. So that's an incredibly good prediction. The test is 100% reliable, or as close as it can be. Assuming the sequencing facility doesn't mix things up, you should get a definitive answer, and it's not going to change throughout your life. Is that how many people are getting that test? Not that many. And I don't know. We published in Journal of Alzheimer's Disease a statement about whether we thought it was of value to get the test. I think it depends. In that particular case, we suggested it's really important to get it counseling, because even if you're homozygous E44, it doesn't mean you're going to develop the disease, because people may make plans with their life. I mean, they could commit suicide. They could do lots of things that are inappropriate and actually never develop the disease within their life. So in between all those three things, I think that biomarkers, definitely research in the area is very important, but really needs to be seasoned. What is the outcome of knowing the answer?